2020 was a year like no other, as the Physician Society of Central Florida geared up to plan a year of social gatherings, meetings with our representatives, conferences, and fundraisers. Suddenly, everything changed, and we began to adapt to a new way of life that has lasted longer than many of us thought possible. Virtual became the buzzword for our organization, and we found ourselves navigating a new way of gathering with our peers in an effort to stay connected through the unexpected. The PSCF heard the cries from our members for PPE and quickly began working to secure inventory that could help our smaller physician offices stay open and continue seeing patients in a safe environment. The PSCF staff quickly learned about the art of taking orders, tracking inventory, and shipping product. Our partner Matchup Promotions was instrumental in the success of this project, providing a warehouse for PPE inventory, fulfilling orders, and getting those shipped out as quickly as possible. It's amazing what a community can do when they work together. Although the PSCF couldn't host gatherings and in-person meetings, we didn't let that stop us. Your board of directors became Zoom savvy, meeting more than usual to discuss the PSCF response to the pandemic. In addition, the PSCF hosted a virtual distance learning series from September through December, partnered with Orange County government to host the annual Physicians Healthcare Conference, virtually of course, held the annual CME program online so our members could continue to get the CME credits they needed for licensure renewal, and just recently hosted a Tri-County coding seminar to help our member practices understand the new E&M coding changes. In addition, our physician delegates to the FMA participated virtually in the annual meeting over the summer, making sure that the voice of Central Florida physicians was still heard. Our Political Action Committee conducted numerous phone interviews during election season, getting to know all the key candidates running for office, and made endorsements of those whom they felt would be advocates for our local physicians and their patients. The PSCF has also been working hard over the past year to set up 2 health insurance programs for our members that we hope will help them control this costly portion of running their practice. For larger practices, our self-funded health insurance program provides transparency and cost containment tools to let physicians take control of the health insurance benefits for themselves and staff members in a risk-contained environment. The PSCF has partnered with FBMC and Dana Gracie to create and manage this innovative program. For smaller practices, our co-op program through Florida Blue provides affordable health insurance to employees, physicians, and their families, and establishes a stable alternative to those carriers who often abandon the insurance marketplace. Through this health insurance co-op, participating physicians have the potential to share major profits, save money, and offset future rate increases. In addition to our new health insurance programs, the PSCF is also excited to announce its new partnership with the Greater Orlando Healthcare Guide to provide special recognition for PSCF members to the local healthcare community. This guide is a comprehensive listing of healthcare providers in Orange, Osceola, and Seminole counties and is used a minimum of 20 to 30 times every day by medical professionals. The guide has a readership of more than 180,000 through 8,000 printed copies and unlimited access to the e-publication and digital downloads, which are only available on the PSCF and Heritage Publishing websites. Members of the PSCF should be receiving a copy of this guide in the coming weeks, so please keep an eye out for it. With all the changes and programs for our practicing physicians, we should also note that medical students were hit hard by the changes of 2020. Many saw their classes go to remote learning and didn't get to participate in their clinical rotations. The PSCF saw a need for our local medical students to connect with physician mentors for encouragement, advice, and support now more than ever. Therefore, the PSCF mentorship program was created. This program paired up physicians of various medical specialties with local medical students. During its first year, our program was able to match 20 students and physicians together. Many have had to meet virtually, but some were able to meet up and even shadow their mentor in clinic. In addition to the strain this year has put on our medical students, the pandemic has placed an even greater burden of stress and anxiety on many of our practicing physicians. Many saw elective procedures cut at some point during the year, feared contracting the virus and spreading it to their loved ones, and worked endless hours to care for their patients. As the pandemic has dragged out, many physicians have felt the strain of burnout wearing on them. The PSCF Foundation responded with the creation of the PSCF LifeBridge Physician Wellness Program. This program was designed to address the seriousness of physician burnout in our community. The program is a resource for our members that is voluntary and confidential. Members can schedule up to 4 free appointments a year with our counselors through a confidential appointment line. The program is mindful of privacy and confidentiality, and no information is disclosed to others, including the PSCF staff. The program currently has 3 certified counselors that are available to meet in person or by phone. Members can call 844-234-LIFE to make an appointment. In order to fund the LifeBridge Physician Wellness Program, the PSCF Foundation held an annual fundraiser, virtually of course. On November 6th, the foundation hosted the virtual wine tasting event where members enjoyed bottles of wine straight from Napa Valley shipped to their door. The program was done over Zoom with a sommelier based out of Napa leading the tasting. There were also some fun trivia, music, raffles, and great prizes given away. The foundation ended up raising over $6,000 for the new wellness program during the event. Although 2020 didn't go anything like we had planned, we were stretched and strained more than we thought possible. We have come out the other side stronger and with hope for a new year where we can work together to improve the health of our community, lift up our colleagues, and go forward better than we began thanks to the experiences, trials, and tribulations of the past year.